Hi everyone, my name is Amy Schex and I am an occupational health specialist here at Inscuto Memorial Hospital. Today we are going to be discussing ionizing radiation with each and every one of you who are our new radiation tech employees. So welcome to the job. I'm very excited to be here today with you guys, and we will go ahead and dive right in. Very quickly, before we get rolling, here's a quick disclaimer. This is a student presentation. This is a completely hypothetical scenario and is solely for educational purposes. I am a UAMS student and not a representative of any agency as mentioned. So today we will be discussing a number of things regarding ionizing radiation. So first and foremost, we are going to define what it is and how it is used, both everywhere and within our hospital. We're going to discuss the health effects as a recipient. We will discuss the health effects as a provider. Then we will dive into the effects of these chemicals on the environment. And then lastly, we'll discuss protective measures that you guys can take and that all of us can take to keep ourselves, our patients, and the environment safe. Okay, so first and foremost, we should dive into what exactly is ionizing radiation. So ionizing, by definition, is just going to mean to remove an atom. So ionizing radiation is any radiation that has enough energy within itself to remove an atom from a molecule. So this is used in medicine, and it also naturally exists in the environment around us. So in your jobs and in the hospital that we're currently in, this is going to include x-rays, like the actual x-ray itself that someone might get after they have a potential bone break. This is also going to include CT scans, fluoroscopy. One of the newer applications of ionizing radiation is going to be nuclear medicine. And this is going to be in forms like PET scans or radioactive scans. And then lastly, this can be used as radiation therapy, like you may have heard of for cancers. So to break this down a little bit further, there are two broad categories of ionizing radiation. And the first one is going to be the waveform. So this is going to include X-rays and this is going to include gamma rays. So that covers all the things listed there that say X-rays, CT scans, fluoroscopy. Those are all X-ray forms. The other form, gamma ray, is going to be what we see in nuclear medicine with PET scans or radioactive scans. The other type that we have is called particles. So particles are going to include beta particles, alpha particles, and neutrons. This is maybe something that most of the general population is a bit less familiar with. For beta particles, for instance, one way that they are used is in hyperthyroidism. You can use radioiodine I-131, which is an isotope, and this can be uptaken by the thyroid and then will cause destruction of the thyroid tissue and thus treat hyperthyroidism. So all that to say, ionizing radiation is all around us, and these are common applications of it. So as briefly mentioned in the last slide, there are lots of indications for IR. So it can be a very useful diagnostic and therapeutic tool. For instance, in x-rays or CT scans, this is an awesome way for providers to identify what exactly is going on and to see things internally by not causing any sort of surgical or invasive procedure. Generally speaking, it's decently low harm. We will discuss this more as we go, but if the dosage is limited, as we again will discuss later, then there really is pretty low risk with each procedure. This is also useful for things like cancer radiation, though you're going to have to use typically higher dosages and probably have a lot more side effects as such. This is our best way right now of treating a lot of cancers. So, as you may expect, there are quite a few risks of ionizing radiation, both to our patients and to you all. Most of this is going to focus on the risk to you guys because this is what we, as an occupational health specialist, and the rest of my occupational health team are most concerned about. So, first and foremost, this can induce mutations that are involved in disease and cancer formation. So if you have prolonged exposure to ionizing radiation, x-rays, CT scans, PET scans, etc., then this can induce harm directly by creating free radicals, which can then harm DNA, which can then cause cell death, which can make things like cancer more likely. And cancer is obviously the extreme here, but it can also make other diseases more likely, as generally speaking, when our cells are damaged, we have weakened immunity to things and also just weakened cellular response. This can also be teratogenic, which means that if someone were to be pregnant, then this would be harmful to the fetus within them. This can also cause infertility, as this can be extremely harmful to gonads. Ionizing radiation has been linked to cause cataracts. It's not fully known how, but some of the biochemical pathways that create like sorbitol and galactose and other things within our eyes can impair vision. And then acutely speaking, which we'll discuss a little bit more later on, it can cause things like nausea, vomiting, diarrhea, and bone marrow suppression, which makes you more susceptible to any infection if you don't have the proper immune cells to fight it off. It can also cause burns or ulcers, as you may first and foremost lose the cell layers that proliferate the most are going to be most susceptible to ionizing radiation. So this is going to make things like your skin mucosa and your hair follicles the most susceptible to these chemicals. So ionizing radiation also poses potential risk to the environment. This can be harmful to plants, animals, and natural ecosystems. This can affect the diversity of ecosystems, which can be catastrophic for other species, can also be catastrophic to humans because we also live in our ecosystems. It can also cause water and soil contamination, so that's going to affect humans and animals alike. When our waterways are contaminated with this, then we too are going to ingest it without proper filtration and chlorination methods. Over time, these chemicals can also bioaccumulate within us and other species. So that's to say, for example, if a fish lived in a waterway that was contaminated with ionizing radiation, their skin, body, whatever, would be affected by the radiation and they would carry it within them. If someone were to go fishing and catch said fish and then eat said fish, they too would ingest the ionizing radiation, and they too would have more of it within them because they ate it from the fish and maybe they also drank the water too. So that's the general principle of bioaccumulation, and it applies to ionizing radiation as well as other things within our ecosystem. Okay, now that we have discussed all of the very scary potential consequences and risks associated with ionizing radiation, it is important that we talk about how these things can be prevented and how we can safely use this awesome tool. So, first and foremost, lead shields are required for all staff while in the imaging room. I will say this again, lead shields are required for all staff while in the imaging room. This is to protect yourself and to ensure that you are not receiving entirely too high dosages of ionizing radiation. One thing you will notice here, you can see all of the lead shields in this lady wearing them on the right here. You will notice she is wearing a thyroid shield and a shield covering her chest, and then a shield covering the top part of her legs. The idea here is first we're going to cover that thyroid tissue, then we're going to cover breast tissue as well as lungs and maybe some deeper organs. Then we're going to cover gonadal tissue, as these are the things that we know are most susceptible. That being said, we are trying to prevent any big significant risks, so these shields are an appropriate way to do so. Something that has recently changed in the last few years is that patients are not required to wear lead shields anymore. This is for a few reasons. One of them being that wearing shielding would sometimes interfere with what we were trying to see and what we were trying to scan. And so it was found that by wearing them, sometimes we would actually cause patients to have to get more radiation because they would have to do the scan again. So now we are saying that patients do not need to wear the shields. They are already being exposed to the radiation, and the shield did not provide enough shielding for them to make it beneficial. The other way in which we are minimizing the risk for you guys is by using dosimeters. So dosimeters are also pictured up here in the top right. This is a little machine that monitors how much radiation you have been exposed to. This is very important that you all use each and every day, and it's going to monitor your individual exposure, not how much may have happened to the patient, but how much you yourself were exposed to. Lastly, one of the guidelines that we follow here is the ALARA principle. So this stands for as low as reasonably achievable. So something we do for each of you guys, and we will do for all of our patients, is try to ensure that the radiation dosages we are administering are always as low as reasonably achievable, because we do not want our patients to be at any higher risk for all these adverse effects, and we do not want you guys to be at any higher risk for these adverse effects, so we will limit it best that we can. As mentioned, here are the guidelines for exposure that we follow. These are from OSHA, and they set strict guidelines. We will monitor these by using our dosimeters, as pictured again here. You can see that for the whole body, the head and trunk, active blood forming organs, lens of eyes, or the gonads, you are set to 1.25 rems per quarter. These are the occupational standards. These do not apply to patients. These only apply to you all. You can also see for hands and forearms, feet and ankles, that's 18.75 rem per quarter. And then for the entire skin, we're saying 7.5. Again, this will be monitored with dosimeters, and we will show you more as you progress through orientation of how to do this within our system. As I mentioned, these standards are to be upheld by everyone here at Enscudo Memorial Hospital. So although we've mentioned ways that you can try to reduce the risk of exposure as much as possible, it is important that we have a plan in place to know what to do if you're exposed. So if you are exposed in a way that is unhealthy, say something goes wrong with the machinery, things are out of the ordinary, it is unsafe for you. We are going to ask that you limit the time, increase your distance, and use shielding. Use shielding you will already be doing at the job. As mentioned before, this is required within the imaging rooms. But limit time means immediately leave the room. Get you and any other people out, and limit your time that you are directly exposed to this. Increase your distance. Go as far away from it as reasonably possible. If you were directly exposed, remove all of that clothing and immediately wash skin. Lastly, you will notify your supervisor and present to the ER. From there, they will seek to do whatever testing they can do to reverse the effects. There are things that can be done to reverse effects of immediate exposure. For instance, if you were contaminated with radioactive iodine, isotope 131, then we can give you, or another provider, potassium iodide, which will block the uptake from the thyroid and will protect you. So it is really important that you take these matters seriously and immediately react to them. One of the final things I'll mention is how we can minimize our exposure to the environment. So, though all the work we do here at Inscudo Memorial Hospital is important, it is also important to recognize that we exist within a broader context, and what we do here at the hospital has downstream effects on the world around us. So, as mentioned before, we will still follow that ALARA principle as low as reasonably achievable whenever we do anything with radioactive waste. We will also appropriately dispose of materials. Anything that has been contaminated with radioactive materials needs to go into these yellow bags. This is going to help us make sure that the waste is handled appropriately and is not just excreted into the environment and causing those downstream contaminations in water and soil. There's also on-site radiation monitoring that is done by our occupational and environmental health team. You guys do not have to be directly affiliated with that, but just to know that it happens. Okay, that wraps up everything that we needed to discuss today. If you have any questions, I will be happy to field those now. Otherwise, thank you so much for your attention. Should you ever need anything, please reach out to me at this email, and I would be happy to assist you. Otherwise, welcome to the new job, and we are so excited to have you. Here are my references on the next 4 slides.